Hello, my name is Hannah Derue. I am a PhD candidate at McGill's Integrated Program in Neuroscience. I'm co-supervised by two principal investigators at the Alan Edwards Center for Research on Pain, and today I'm presenting my recent publication titled Therapeutic Exercise Interventions in Rat Models of Arthritis. Arthritis impacts approximately 6 million people in Canada and is expected to impact 9 million by the year 2040. Arthritis includes one of two forms, osteoarthritis, or OA, which is defined by bone remodeling and cartilage degradation, or rheumatoid arthritis, otherwise referred to as RA, which is also referred to as inflammatory arthritis. Both forms of arthritis include bone erosion and thinning cartilage, but rheumatoid arthritis also has a significant inflammatory component. As a result of these conditions, many people suffering from arthritis report pain that impacts their ability to participate in activities including work. Over 23% of women and nearly 17% of men in Canada are currently living with arthritis. And the problem is that existing medications and interventions are not very effective at restoring function or alleviating pain in either of these two arthritic conditions. But exercise has the exciting potential to be easily accessible and cost-efficient for many with arthritis, and with potentially great outcomes on daily life. This includes improving the range of motion of the affected joint, overall function, return to work, and other metrics of pain alleviation. Here's the snapshot of the main findings of this review. We found that most studies in this field use rats rather than mice or other rodent species. For the purposes of this review, only rats met inclusion criteria. Forced exercise using a treadmill was by far the most popular method of movement paradigm, far surpassing the use of voluntary movement paradigms. 79% of all studies in this review used forced movement. Studies that met inclusion criteria found changes to bone remodeling, immune markers of inflammation, and changes to molecular markers of cartilage health, but pain behaviors themselves were under-investigated as outcome measures. Furthermore, there were no studies that included both male and female animals in their study, which could be of critical importance to better understanding how therapeutic movement influences pain outcomes, since there are already well-established sex differences in pain processing which could play a role in this proposed relationship. This review used a systematic methodology. Together with library services at McGill, a search strategy was designed with the intent of gathering all publications concerning preclinical studies that investigated the impact of therapeutic exercise, or exercise started after the experimental induction of a model of arthritis. A search was conducted of Embase, Ovid, Biosys, Web of Science, and Scopus databases, due to their non-overlapping databases which span much of the life sciences. Only English-language articles were included in this review. And though all rodent models of arthritis were eligible for inclusion in this review, only rat models met the inclusion criteria. The studies must have used a rodent model of arthritis, whether it was surgical, genetic, or a chemical model, and included movement as a therapeutic intervention. Movement must have been introduced no greater than 1 week prior to the initiation of stimulated arthritis model in the rodent, which would have been classified as a preventative exercise intervention. Studies were excluded if exercise was used as a noxious stimulus rather than as a therapeutic intervention. One of the most shocking findings of this review was the incredible amount of variability in the experimental design of sources that met inclusion criteria for this review. The duration, or the amount of time for each movement session, varied from a few minutes to several hours a day. The frequency of movement, or how often the movement session was conducted in a week, ranged from once a week to several times a day. The intensity of the movement, otherwise referred to as the velocity of movement, was the most impressive variable. Movement velocity ranged from 6 meters a minute to upwards of 20 meters a minute. Furthermore, the reinforcement method was often not reported in the text of sources that met criteria. This could be because it was implied that forced exercise with the shock grid was the only option being used in the field at the time of publication. However, this poses challenges to replicability now that new approaches like voluntary movement are being introduced to reduce the impact of confounding variables. Outcome measures and studies that met inclusion criteria for this review included central nervous system changes, peripheral nervous system changes, and occasionally pain behavior outcomes. Central nervous system changes associated with regular therapeutic exercise included changes to the endogenous opioid system in key brain areas, including the periaqueductal gray and the retroventral medulla. With regular therapeutic exercise, pain signals from experimentally stimulated arthritis can be blocked at the level of the spinal cord or the brain by the blockage of cyclic AMP, or CAMP. This causes a signaling cascade within neurons in these key brain areas that inhibits the phosphorylation of NMDA receptors. This effectively dampens neuronal excitation. In the peripheral nervous system, several changes were found to bone morphology, local cytokine secretion, and cartilage degradation when exercise was introduced after the experimental induction of arthritis. On the left is an example of a sedentary joint with arthritis, exhibiting typical cartilage degradation, increased secretion of pro-inflammatory cytokines, as well as bone fragmentation and an overall altered joint structure. On the right is a representative image of the arthritic joint within the context of regular therapeutic movement interventions. Based on evidence found in this review, even lower intensity movement was able to increase expression of genes involved in the preservation of cartilage, effectively preserving the structure and function of the joint through increases in ACAN, COL2A1, and TIMP3 expression in the cartilage. There was also both an increase in anti-inflammatory cytokine expression, like IL-4, in the joint synovial fluid, as well as a concurrent decrease in the inflammatory cytokine presence in the synovial fluid, including IL-1 beta, IL-6, and TNF-alpha. What's interesting, however, is that pain outcomes in these preclinical models were underassessed, so whether these molecular and histological changes identified by this work actually translate to a pain reduction has yet to be explored in detail. We know from clinical evidence in people who have arthritis that joint pathology does not always correspond to the level of pain experienced. To summarize findings to date, there were some problems with the reporting of methodology that is key to reproducibility. Coinciding with this is a lack of a uniform approach when it comes to the experimental design of paradigms regarding the duration, frequency, and the intensity of movement. These factors make it hard to compare the results of various studies within this field. Furthermore, we know that most patients in the clinic with arthritis are women, so it was shocking that 90% of sources included only male rats in their experiments, and none of the sources included both male and female rats in order to conduct an analysis of potential sex differences in therapeutic exercise interventions for arthritis. Finally, the experimental design of research conducted should more adequately reflect questions of clinical relevance. Do men experience more of a benefit than women with therapeutic exercise, or vice versa? How much exercise and what modality of exercise are beneficial to reducing pain in clinical settings? In the end, there is still much to be done when considering how preclinical research in this field can be used to generate findings which contribute to more effective patient care plans in the future. I'd like to thank my lab mates from the Ribeiro da Silva lab for their help during the creation of this manuscript. Finally, if you want to learn more about the publication that I've described in this video, the publication which is the basis of this presentation is published in the journal Neurobiology of Pain and is available open access online. For more information about our work at the Alan Edwards Center for Research on Pain at McGill University, you can visit mcgill.ca/painresearch or follow the AECRP on Twitter at AECRPain.